It's been another record day of new COVID cases for Victoria, and that's set to put even greater pressure on the state's beleaguered health system, already near breaking point. The daily record was smashed again, 1,838 new cases. And sadly, 5 more people have died. The continued rise in infections is sure to mean hundreds more COVID patients calling on stretched emergency services in the coming days. To help ease the burden, Defence Force personnel are being recruited to drive ambulances. Triage tents have been set up in hospital car parks. And there's to be a review of the 000 call system. Here's State Political reporter Richard Willingham.
Emma Mackey was left hanging by the phone in agony, waiting for help.
I've never felt that kind of pain. I've had 3 children and that pain was excruciating.
After returning from hospital with suspected kidney stones, Miss Mackey's pain returned. Help arrived 5 hours after she called 000.
They just kept saying, you know, someone's on their way.
The state's emergency call system is in crisis, exacerbated by COVID, with many patients facing long waits to even get through to an operator. At least 2 people died from heart attacks recently. In each case, calls for help to 000 weren't answered for 5 minutes.
It is an incredibly difficult time right now, and I don't want the community to feel that they're not going to get an ambulance if they need one.
Former top cop Graham Ashton has been called in to review emergency calls. Paramedics will also get a helping hand, with 10 ADF personnel arriving on Monday to drive ambulances to non-emergencies.
I think the rubber band is pulled back as far as it can possibly go.
Ambulance delays are in part due to extra COVID protocols, including PPE, but hospitals often don't have anywhere to put patients.
Unless we fix those problems, we are not going to fix the demand on the ambulance.
Currently, there are 620 people in Victorian hospitals, 114 in ICU, with 76 people on a ventilator. More than 2/3 are unvaccinated.
It is a fundamental fact that Victorian hospitals were under significant pressure before COVID started. It is the situation also in all other states in Australia.
It's really important that we recognise the pressures on the hospital system and what vaccination will do in that regard.
Vaccinations are helping, but surgeries have been cancelled to free up beds and staff, while triage tents have popped up in hospital car parks.
We will not be able to care for people that we would normally care for in the acute system, and the load for that and the triage, as you say, is going to fall back on the GPs.
In the UK, hospitals continue to be slammed by COVID patients. It's been described as a slow-moving mass casualty event by those on the front line. There are warnings the same could happen here once we open up.
We are not prepared for that right now.
Health workers are demanding better cooperation between the state and federal governments to get the system ready for the COVID normal pressure on hospitals.
They need to be predicting absolute chaos, absolute crushing demand on the system.
It's a grim reminder that the hardest part is still to come. Richard Willingham, ABC News, Melbourne.
And Richard Willingham joins us now. Rich, it seems COVID has exposed problems in the health system that have been brewing for a long time.
Yes, the consensus from health workers is that the system has just been strained for a long time before this, and COVID has exacerbated. One of the concerns was that the health system hospitals have been operating at 100 or 105% capacity for years, which leaves no room to scale up. And of course, now we've been hit by this pandemic. There's also concern that the lessons learnt from previous pandemics that didn't get as serious as COVID haven't been learned and implemented, and that simply the health system funding for it hasn't kept pace with population growth. Now, the doctors do stress that despite the crisis going on, that the sickest people will still get treated, and for people to not seek to make sure they do seek out medical help when they need it, and to consult their GP.
And Rich, the Premier has plenty of challenges at the moment, not just the health system, but a few other things on his plate as well.
Yes, there's quite a lot looming for the government. Next week, IBAC begins its public hearings into allegations of branch stacking and, concerningly, the misuse of community grants for political purposes. Now, this could make some pretty difficult reading for some Labor people, and it might expose just the length some people go to amass political power to get into Parliament. The government's vaccine mandates has also hit a snag. Last week, the Premier was adamant that there was no legal impediment to mandating the vaccine for courts and for MPs. Legal advice since has made that impossible, so the courts are now not part of that vaccine mandate, and the Parliament is looking for its own ways to do that. And then finally today, the Premier has landed himself in hot water. He's been slapped with $400 worth of fines for not wearing his mask when he entered Parliament last week. Leanne Wong reports.
Masks on, mask off. While the government delivered new mask mandates for primary school children, it was the Premier who fell foul of the state's mask rules. Daniel Andrews was fined $400 for not wearing a mask on 2 separate occasions this week outside State Parliament as he walked from his car to a press conference.
Under the Chief Health Officer's rules, that is an offence, and any other Victorian, I'm sure, would be fined.
Mr Andrews says he's sorry and will pay the fine as masks become part of more school uniforms as well.
It is backed by good science, it is simple, it is safe.
All kids in grades 3 to 6 will need to wear masks indoors when they get back into the classroom, while it's strongly recommended but not been made compulsory for children in prep to grade 2.
I would completely leave it up to her. I'd give her one and tell her if she felt comfortable wearing it to go for it. But I certainly wouldn't expect her to wear it all day. I don't think it is practical.
It would be a bit annoying because people won't be able to see your smiles, but you should still be able to play.
From tomorrow, there'll be some relief for adults, with masks allowed to be taken off when drinking alcohol at picnics. But as Victoria sets another national record of daily infections, experts have warned it's the breaking of rules in small ways that's starting to add up.
Especially vaccinated folk, have been kind of letting their guard down. But, if we don't really get this outbreak under control, then we may not be able to have the rules loosened when we were hoping they were going to be loosened.
It comes as the government's vaccination mandate for all authorised workers hits a hurdle, with federal workers and court employees revealed to not be legally bound by the state's mandate due to a separation of powers. The court system says it's looking at its own measures to enforce vaccinations.
We are working on mechanisms to make sure that every member of Parliament complies with the same sort of requirements that the public is expected to comply with.
What the government is doing here, it's coercion, it's undemocratic, and I won't comply.
For Victorians who can't work, COVID-19 disaster payments are still available after the Commonwealth declared Greater Melbourne as well as the Mitchell Shire as hotspots for another 7 days. That'll be scaled back once vaccination rates hit 70%. What's also being scaled back is the police presence on the New South Wales border after more regional areas were added back into the border bubble. Leanne Wong, ABC News, Melbourne.
As we go to where there's good and bad news for the regions, Greater Shepparton and Moorabool Shire will emerge from lockdown later tonight, but Mildura is about to enter a 7-day lockdown. And for more, we're joined by Richard Crabtree in Mildura. Richard, what's the situation there?
Yeah, as mentioned, a 7-day lockdown from midnight tonight. That comes after 7 cases were reported in Mildura this morning and a further 3 cases have been detected today. That brings the total number of active cases in Mildura and in a nearby border community to 24 active cases. The vaccination rate in Mildura, fortunately, is high. However, that's not the case for the region's Indigenous community. Just 60% of Indigenous members in northwest Victoria have had 1 dose of a vaccine, 33% are fully vaccinated, and we've heard from a local Aboriginal health service here that there are concerns for the growing number of cases within that community in Mildura. So unfortunately, that is a serious concern at the moment here in Mildura.